Good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Monday, June the 1st, 2020. Joining us today, Mayor John Tory, Toronto Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor?
Brad, thank you and good afternoon. While it's not COVID-related, I thought it was appropriate and important to begin today by making some comments on events here and in the United States which are on the minds of many of the residents of the City of Toronto. On the weekend, immediately after Saturday's peaceful but very heartfelt march, I acknowledge the hurt and the frustration and the anger and the emotional fatigue that I know many people are feeling across North America, including in our own city. I went on to say that we are shocked at what we see happening in the United States, but we must acknowledge that we are not immune from some of those very same issues right here. Anti-black racism does exist in our city and in our country. That is an important and honest acknowledgement for me to make as your mayor, because it forms an important part of the framework for action. You have to be honest about the existence of a problem if you want to meaningfully address it. This past weekend, thousands of people marched peacefully in our city to register a total rejection of anti-black racism and anti-Indigenous racism, causes shared by all of us. We have taken some important first steps in the City of Toronto by establishing, for example, North America's first anti-black racism unit, which is hard at work on this issue inside the government of the City of Toronto. The peaceful march we saw here in Toronto indicates a genuine desire of many people to be heard on these issues and to help to find solutions. I am proud of the way that we as Torontonians expressed our solidarity and our determination to do better. The fight for justice and equality and the fight against racism and discrimination is one that all Torontonians support. That means we must step up our efforts and renew our dedication to this cause like never before. As Masai Ujiri said it so well today, the conversation can no longer be avoided because it is hard. Consistent with the theme of who we are as Torontonians, I want to also acknowledge that June 1st, today, represents the start of Pride Month. Pride Month has been one of our city's most anticipated festivals that usually brings people from all over the world. But of course, this is no ordinary year, and some of that will not be happening. But I did have the honor today of raising the rainbow and transgender flags with my colleague, Councillor Kristen Wong-Tam, and Jad Jabber from the Pride Board of Directors. Pride is a celebratory month, but is also a time to acknowledge the work that we must continue to do to end any sort of discrimination or hatred or violence experienced by our LGBTQS communities in our city. Toronto prides itself on being not only the most diverse city in the world, but a city that is embracing of everyone, no matter what their religion, their skin color, or their sexual orientation. Raising the flags today is important for that exact reason. So happy Pride to our entire city. Please participate in the virtual events and send a message of both celebration and solidarity. Also today, the Government of Canada announced it will be accelerating the expected gas tax funding to cities, including the City of Toronto, in one lump sum payment. Toronto will receive $166 million of this gas tax funding by June the 10th. We'd been planning to receive this funding before COVID-19 struck, so the fact it is still coming, and coming on an accelerated basis, is good news. This announcement is a good start, but it does not represent the comprehensive response needed for cities, including the City of Toronto, and it is not new money. I say it is a good start because today the Government of Canada acknowledged more funding would be coming to help Toronto and other municipalities. Toronto alone, as you may recall, will be short at least $1.5 billion due to things like reduced transit revenues and ridership and lower land transfer tax revenue. That help from the other governments, both provincial and federal, must come soon. I was pleased to hear Prime Minister Trudeau acknowledge the urgency of funding for municipalities and the critical role that cities will play in ensuring a safe restart and a strong recovery. A strong restart and recovery will only happen with strong cities. Toronto, the economic engine of Canada, is ready to do everything it can to get our economy back on track, but we can only do that with the support of the federal and provincial governments. I know Premier Ford knows that too, and I want to thank him for the work he is continuing to do with his provincial counterparts to work towards a national answer, national in the sense that it is joined in by both the federal and provincial governments, a national answer to these very serious financial problems faced by Canada's cities. Now, as our city starts to slowly reopen and rebuild itself, we are constantly looking for new ways to make that transition easier on our city and on its residents. COVID-19 has proven itself to be a most deadly enemy. It has no bounds on who it will infect or who it will hurt. One thing we have realized throughout this past few months is that COVID-19 has particularly impacted our most vulnerable communities. While we have made huge strides in managing COVID-19 in the shelter system, we know there is more work to be done and that the threat of COVID-19 will be with us even as we move into restart and recovery. That is why I'm pleased to announce a new partnership between the City and the United Way of Greater Toronto on Toronto's COVID-19 shelter interim recovery strategy. This partnership will help develop a strategy that will guide our ongoing response to COVID-19 in our shelter system over the next year to help individuals experiencing homelessness. It will include ways to minimize the spread of COVID-19 in our shelters to help protect both clients and staff, and this will be made possible by continuing the ongoing coordination with the healthcare system itself. In partnership with our stakeholders and the United Way, we will engage with community providers, Indigenous communities, health sector partners, regional municipal partners, and the public to discuss the city's shelter system, to discuss homelessness, and how best to address the impacts of COVID-19 on that system. Over the next month, the City and the United Way will hold these meetings, will conduct surveys, and have discussions with our partners in the health, housing, and shelter sectors. This engagement will focus on pandemic lessons learned so far, best practices on support for the homeless and ending homelessness, and more integrated health support for our homeless populations. After consulting broadly, including with those with lived experience, we will release an action plan which builds on our interim COVID-19 response. From the onset of the pandemic, we have worked to implement policies and supports and services as quickly as possible because there was no time to wait. We opened 2 recovery sites with proper medical supports for shelter clients who tested positive. We successfully moved almost 3,000 people, 2 hotels, interim and permanent housing, and additional temporary respite sites so as to allow for physical distancing. We continue to permanently house and support individuals experiencing homelessness through the city's Rapid Rehousing Initiative, which has helped so far at least 820 people. We were able to move 166 people from dangerous and precarious encampments in our city into interim supportive housing. We continue to screen and test clients in the shelter system to work to avoid outbreaks and to contain the spread of the virus. And we have achieved 100% physical distancing of 6 feet between beds in 7,000 existing shelter spaces, plus all 31 new temporary response sites. This work is not possible without the help of Shelter Support and Housing Administration Division, partners like the United Way of Greater Toronto, and of course the shelter and support staff who have been committed to help their clients throughout and who have done an incredible job that just those statistics I just mentioned are only a small part of what they've achieved in doing something we committed ourselves to doing from the very beginning, namely to look after, first and foremost, our most vulnerable populations. All of those members of our staff and the agencies and others who have helped us, including volunteers, have our immense gratitude for this extraordinary dedication to some of our most vulnerable residents in the City of Toronto. The work of reopening city facilities is continuing. Today, the Toronto Public Library reopened 53 additional library branch drop boxes to accept the return of library materials, which is the next step in its rollout of curbside drop-off and pick-up service. Toronto residents will be able to start scheduling the pickup of their reserved materials as of next Monday, 1 week from today, June the 8th. This week, we are also starting to open some public washrooms in parks. With washrooms, it was and it is very important for our staff to take the time to work with Toronto Public Health on guidelines for the safe use and operation of these public amenities, as these are enclosed spaces that must be cleaned carefully, and of course there is the need for physical distancing while waiting, for example. A couple of important changes in the use of park washrooms are the recommendations that residents wear masks when entering, and also that they wash their hands both on entering and when finished in the washroom. There will be signage up in the washrooms to help remind people of these important measures we can take to protect both ourselves and others from COVID-19. I ask that we're patient with one another while we make these changes, because it might mean, for example, some extra time spent waiting to use a washroom, and that's okay when it comes to placing public health first. The important thing is that we are taking these measures to help keep park goers safe, to help keep the general public safe, and to keep safe the hardworking city staff who will be working every day to keep these washrooms clean and safe as they open. You may be aware that we opened washrooms in both Christie Pitts and Trinity Bellwoods Park over the weekend. This week, we're opening washrooms in almost 50 parks, with the remainder opening in the days to come after that. A list of open washrooms can be found at toronto.ca/COVID-19. The process of opening our amenities, like park washrooms, is happening gradually so that it can be done with the best results for the ongoing health of the public and of the city cleaning staff. Toronto Public Health has provided recommendations for cleaning at all washroom locations, including a deep clean once a week at all sites. Toronto Public Health has also advised that water fountains and bottle filling stations at these sites may also open with daily cleaning and disinfection. And so, in the end, ladies and gentlemen, solidarity remains key. Solidarity on following public health advice. Solidarity on support for cities, much needed support for cities. Solidarity on support for our most vulnerable. Solidarity with our LGBTQ2S communities and with those experiencing racism and discrimination. We've said from the beginning that we are all in this together, and that's how, as a city, we will get to where we want to be and to where we need to be. And on that note, I will call on our Medical Officer of Health, Dr. Eileen to give her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 164 new COVID-19 infections in Toronto. To date, 8,630 people have recovered, an increase of 184 since yesterday. As always, for more detailed data on the status of COVID-19 cases in our city, I would ask that you please visit our website. Earlier today, the agenda was published for our next virtual Board of Health meeting that will be taking place on June the 8th. At this meeting, I will be providing an update on our COVID-19 response. With the report for this agenda item now public, I thought it would be a good time to share this information with you. Since January, my team and I have been responding to the COVID-19 outbreak here in our city. In the earlier phases of the pandemic, our focus was to prevent COVID-19 cases, protect our city's vulnerable residents and the capacity of our local health system to care for us, and to save lives. We achieved this by implementing strict public health and physical distancing measures. While COVID-19 has drastically altered our lives, and tragically, we have lost too many of our friends, our family members, and other loved ones to this virus. As I have stated before, thus far, we have averted what could have been much worse. If you hadn't done your part, we could have been experiencing tragedies similar to what we've seen in other parts of the world. But we are not out of the woods yet, and we need to remain diligent and focused as we move forward. As we seek to rebuild our local economy and restore the quality of life in our city, Our recommended approach, which is in keeping with the provincial framework, calls for the gradual reintroduction and restart of activities and businesses. This will start with lower-risk activities and allow for sufficient time between phases to monitor our data and to observe the effects of these changes on virus containment, on healthcare capacity, and on public health capacity. The recommendations that I will be sharing with the Board of Health next Monday are focused on ways to improve our ongoing COVID-19 response based on our experiences to date. A critical component of our work will continue to be case investigation and contact management and follow-up. Although these are actually two distinct areas of public health activity and are often described in the popular media as contact tracing, these aspects of our public health response are amongst the most important when it comes to containing the spread of COVID-19. Case investigation, which involves very thorough interviews with those diagnosed with COVID-19, is aimed at achieving two key objectives. First, to establish where the individual may have acquired their infection with COVID-19, and second, to determine where, when, and with whom the individual was during their period of infectiousness. All of the information gathered from the individual is then used to implement appropriate COVID-19 prevention measures, such as quarantine, early referrals for assessment and testing for close contacts, and the use of personal protective equipment or cloth masks, to name just a few examples. In addition, by gathering and analyzing data from our case investigation and contact management processes, we are able to understand how COVID-19 is spreading in our city and impacting our residents. These data inform our strategy to protect your health and help us to determine when we need to adjust our actions. It tells us when we are in a position to safely ease our public health measures and continue to reopen businesses in our city. Next week, I will also be sharing an update with our Board of Health on the ongoing opioid poisoning crisis, which has been further compounded by the COVID-19 pandemic. These dual public health crises are having significant impacts on people who use drugs in our community, their families, their friends, and their loved ones. Other than drug policy, one of the best ways to protect people from overdose is providing for close proximity to others and not using alone. Unfortunately, the COVID-19 pandemic and the measures that were implemented to promote physical distancing, which was necessary to contain the spread of COVID-19, have forced harm reduction and other services that people rely upon to significantly reduce their service offerings and their service hours. These are the subjects that we will discuss further at the Board of Health meeting next week. Finally, today marks the start of Pride Month in our city. Typically, this is a celebration of life with many gatherings and events. This year, given our current circumstances, I encourage everyone to take part in the many virtual ways to celebrate and support each other. In closing, I would like to thank you for your continued commitment to our public health measures to reduce the spread of COVID-19 in our city. I know that this gets more challenging as time goes on. But together, we are protecting the capacity of our healthcare system to care for those who are sick, so we can avoid the tragedies that we have seen and are seeing in other jurisdictions. This is how we can all best get back to enjoying our city. So please, continue to practice physical distancing, and please continue to take care of each other. I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. I too would like to start off this afternoon by acknowledging our amazing city for the way in which the Justice for Regis and George Floyd protests were carried out this weekend. These are important yet very difficult conversations, and I'm so proud that once again the City of Toronto chose a path of peaceful and safe demonstration as opposed to the violence and devastation that has been all too common around the world. I would also like to thank our Toronto Police Service members and my colleague, Police Chief Mark Saunders, for their continued professionalism and public service, clearly evident in the way they managed this weekend's protests in Toronto. By way of update, as a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. As we are now entering the restart phase of COVID-19, I am directly connected with Saad Rafi and the Toronto Office of Recovery and Rebuild team. We are working together to ensure that responsible, robust, and comprehensive restart plans are in place that prioritize public health and safety while we work together to restart our city as very soon as possible. Our Emergency Operations Centre continues to lead the response-related aspects of COVID-19 in Toronto and continues to operate vital services such as the PPE Task Force. Our EOC will continue to support the work of the Office of Recovery and Rebuild as we move through these unprecedented times. I would like to take a moment to provide an update on recent enforcement operation in our parks. Over the past weekend, we received 189 complaints relating to non-compliance in parks, and we issued a total of 15 tickets. Over the month of May, our enforcement team engaged with 7,275 residents by providing education on provincial orders that include physical distancing, in addition to issuing 45 notices and 187 tickets. In closing, I also want to acknowledge and thank every resident, business owner, and everyone in our city who's being impacted as we do our very best to stop the spread of COVID-19. As always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. And with that, please accept my congratulations and very happy Pride on the start of what hopefully will prove to be a week or a month rather of celebration, albeit different than normal. So happy Pride, everyone. Thanks, Brad.
Thank you, Chief. Before we go to questions, just to let everybody on the line know that we staff on the line to answer questions you may have include Mary Ann Bedard from Shelter Support and Housing, Paul Raftis from Senior Services and Long-Term Care, and Janie Romoff from Parks, Forestry and Recreation. First question is to Ashley Legasic from News Talk 1010. Ashley, go ahead.
Hi, good afternoon. My first question is for Dr. Davila. Doctor, we saw cases provincially get back over 400 today, and a lot of those coming from Toronto. I note that it's been 9 days since the large gathering at Trinity Bellwoods Park. Is there any causation or correlation between the two, and have any cases been confirmed from that gathering?
To my knowledge, not yet. We are continuing to receive data on a daily basis on new cases. I think it is important to note, of course, that there is more testing that is happening as well. And we know that when there is more testing, we should expect to see more cases. It's just a question of how much testing is being done. I think that's to be expected. We certainly will keep you informed and the public informed on what we see over the course of the next several days and what connections we can make back to particular events or happenings in our city.
Thank you. And my next question is for Mayor Tory. I'm wondering where we're at on the reopening of patios. I spoke to someone with Restaurants Canada today who said patio expansions and openings would be literally a lifesaver to a lot of restaurants. And I'm also wondering if the city has considered using any of the land previously marked for active TO for patio expansions.
Well, I received a briefing this morning on the progress we've made, which is considerable with respect to the question of making available extra space for patios that could be on sidewalks, roadways, private properties that are adjacent to existing patios and licensed facilities. And I think we're going to have quite a robust program that will be, with the cooperation of the province, aimed at making extra spaces in that regard available to help restaurants to recover. The question of the opening of restaurants and patios is one that will be determined on public health parameters. It's principally a provincial decision, but informed by, the numbers that we have here in the city of Toronto, and that our medical officer of health will, I'm sure, be involved, as we were at the outset of the closure of bars and restaurants, in helping to make that decision as soon as possible, but not before public health says that it is safe to do so.
Okay, thank you. Next question is to Mark McAllister from City News. Mark?
Mayor, you said that it's a good start to see that money from the feds this morning. Wondering if you have any plans to do anything different than what it was already earmarked for, or whether it still falls under the same budget item.
We had expected this exact same amount of money just to come on a slightly slower basis so that it helps us with our cash flow problem, which was not our most severe problem. Our most severe problem was a revenue shortfall of what might be $1.5 billion or more. And so this is a good start in that it's always good to get money in the bank sooner than later, but we need much more help. And I was very optimistic in hearing the Prime Minister, and I know the Premier has been working hard with his provincial colleagues to make sure that some program is fashioned, as they indicated is underway, between the provinces and the federal government to help cities. And that's what's really going to be important to us, is how to make up that lost revenue from transit riders who didn't ride, from land transfer taxes that weren't paid because there are no deals or fewer deals. So that's the real main event, and that I know they're working hard on that. I've talked to the Deputy Prime Minister, the Minister of Infrastructure, and a number of others over the last few days, and they're working hard on this, and we hope for good results.
Obviously, we'll wait to see what we hear from the province in terms of next stages in opening. What can you tell us about what you've heard from the province, and what are you anticipating when?
I've heard that they are listening very carefully to the views expressed to them by all of the medical officers of health, which suggest that they should be taking a look at some of the numbers inside the numbers, and in particular, something that is just based on facts and science, a more acute existing problem in the GTA. And so, we will see how that translates itself into a date on which they might move to stage 2. But we've said all along, and I think they've listened, and I commend them for that, that this should be based on actual science and actual numbers and parameters that they have set out and that have been set out by the medical officers of health from across the province before moving. And I sense they're taking a cautious approach, recognizing how anxious everybody is to see things opened up as quickly as possible, but as quickly as will permit for better health.
Okay, thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead.
Good afternoon. Mayor Tory, we saw today with this funding announcement that the federal government and the province they're still pointing towards this sort of constitutional jurisdiction over who will actually pay what and how much. Can you just describe just maybe your frustration of being caught, one of the municipalities caught in the middle of this when it looks like there may not be a full bailout being offered up by any government?
My frustration is with rules that were shaped by the Fathers of Confederation, God bless them, in 1867, and don't take account of the fact that, a huge portion of the country's economy is now founded in cities, many of which are bigger than several provinces in this country. So that's where my frustration lies. The good news is that the federal and provincial governments, and I've checked with both and know that it's happening across the country, are talking with each other right now to try and fashion a solution. And well, they should. Because if we want to have an effective recovery in this country, if we want to have a robust recovery, then it has to start in the cities, not confined to the cities, but it has to start there. 20% of the GDP of this country is coming out of this city region alone in Toronto. So I'm optimistic because they're talking. They're constructive discussions. Our Premier has been playing a significant role in working with his provincial counterparts. The Prime Minister has indicated he's committed to doing more, and we'll be counting on those results coming forward sooner than later, because we need the help sooner than later.
At the same time, though, it's looking like there is a lack of willingness to actually sort of come forward with money. You know, the federal government has been really laying the groundwork for a number of large payments. Did you have any indication that they may or actually do have an actual number figure that is something that could actually help you out that's on the way?
I can say from my discussions with senior cabinet ministers over the last few days that they're very actively engaged at the federal level in fashioning a program that I think will be substantial in nature and will help in a number of different areas with some of the challenges being faced by cities, but they are quite properly engaged in those discussions with the provinces. I am frustrated by the fact that there's a bit of this, you know, toing and froing going on because of the nature of the Constitution, but at the same time I sense that they're working hard to try and get a solution for us. Our Premier is playing a role in that. The Prime Minister is certainly playing a role. And I think good news will be forthcoming. I can't speculate on the quantity, but I think they know what our needs are, and they know that the alternative, which is huge property tax increases or big service cuts, are not viable at this time for the people who live in cities across the country, including Toronto.
Right, thank you. Next, we go to Michelle Mackey from 680 News. Go ahead, Michelle.
Thanks. This is a question for Dr. Davila. I'm just wondering what the health advice is to the roughly 4,000 people who attended Saturday's protest. I mean, were there any major health risks in that situation?
So with a large number of people, there are always some risks associated with that, given where we are in the pandemic and with the state of COVID-19 in our city. So as has been advised several times now, the most important things that people can do to protect themselves in particular from COVID-19 will include such things as hand washing. And, you know, I trust that people who were feeling unwell stayed away from the event as they should. And certainly so should have those who were already advised for various reasons to isolate because they were already diagnosed as a case or are under suspicion of being a case. Those individuals should have been staying at home anyway. But beyond that, the advice that public health officials throughout the province and indeed throughout the world have been providing to their people is that if you cannot maintain physical distancing, the best thing to do is to wear a mask, not to protect oneself, but to protect others around you. So that advice still stands, whether you are going out into a store or whether you're going out into an event where there may be a congregation of individuals and other people who you know, may have close contact with, may come into less than 6 feet distance from. So for now, those are the pieces of advice that we offer. For those who were not able to maintain that distance and who may not have donned a mask or what have you, the advice would be to monitor oneself for signs and symptoms of COVID-19 and to please go and seek testing and to see an assessment center should you develop any of those signs and symptoms in the next 14 days.
Okay, great. So are you concerned with an increase in cases following the protest? And if so, when would we see the results of that potentially?
Well, certainly the potential exists. We know over the course of this outbreak, what we have found is that people may in fact have COVID-19 infection and either have no symptoms or such mild symptoms that they don't even notice that they've got an infection and they don't seek testing. So we know that there is certainly risk, particularly in those circumstances where people are unable to maintain that physical distancing of 6 feet or 2 meters from other individuals. So there is a chance, it is a possibility. And we know that for most people, from the time that you're exposed until you develop symptoms, it's going to be in and around 5 or 6 days, but in some cases it may be as many as 14 days from the last exposure. So that's why the advice would be, look, if you were in that circumstance and you may have had close contact with people, and we're not able to maintain that physical distancing, that you should watch yourself for signs and symptoms of COVID-19 over the course of the next 14 days, and to make sure that you try to avoid close contact with others so as not to inadvertently spread COVID-19 if you have an infection, and particularly if you're asymptomatic with an infection.
Okay, thank you. We go now to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi, this one's for Mayor Tory. Mayor Tory, I understand that the $166 million roughly that you're going to get as part of this new money, which is, I guess, is equal to about what the city is burning through in a week due to COVID, has to be on infrastructure funding, is what I'm told. Can you tell me exactly, as far as you know, what this money will do for Toronto and put it in context of the need?
Well, I don't think it'll do much new for us because the amount of money we're going to receive, $166 million, was what was projected to be received. We're just going to receive it earlier, so that will potentially allow us some more latitude on our cash flow, which wasn't really a huge issue for us in the immediate short term in any event, but I think for other cities across Canada it might have been a more serious issue. So I'm not saying that there's anything bad about this. It's just that in the context of what we needed, which was a substantial relief on a huge operating shortfall we had, 20 million plus a week on TTC revenues, millions of dollars in land transfer tax revenue, plus the additional costs we've had to undertake to fight COVID-19, this isn't really contributing to dealing with that. And so I'm placing my stock in the pronouncements made by the Prime Minister today and the efforts being undertaken by the Premier to work with his provincial colleagues to fashion, what is the main event, the real deal, as it were, that will hopefully help cities to the extent we've identified, which in Toronto's case is a minimum of $1.5 billion for 2020.
Thank you. And a follow-up is also for Mayor Tory, and that's if you have any update on Camp TO, if you know if that the program is going to proceed, some kind of scaled-down day camp for the City of Toronto.
The city staff are working very hard to try to find an answer on Camp TO, which is what we described as sort of a plan B, so that we could offer some camps not earlier than mid-July to take into adequate account the requirements imposed by COVID-19, physical distancing, staff ratios, and all those kinds of things. And so I would expect it'll be sometime in the next little while we will have a report on that, because obviously if any camps are to be operating in, say, the mid-July timeframe, we would have to allow time for registration and other details to be provided to parents, recognizing that we said from the beginning if we offered this second set of camps, as it were, the registration would be smaller simply because of the increased requirements imposed upon us to operate them in a safe and healthy manner.
Okay, thanks. We go now to Jeff Gray from the Globe and Mail. Jeff, go ahead.
Hi, thanks, Brad. The question is for Mayor Tory, just about the transit money again. Do you have any indication? We've gotten very little, really, in the way of what actually is holding up these talks between the provinces and the federal government. I mean, is it just what the proportion, the share of the check? Are there conditions that one side wants imposed? Or do the provinces not agree? Is there something you can tell us? Do you know what really is behind what I think the mayor of Vancouver called it a standoff or a reverse bidding war? Can you tell us what's going on behind the scenes there?
I think the less important aspect that is causing delay is, making sure that the federal and provincial governments understand exactly what the need is and how that would be, allocated across different areas of need, including transit. I think the more important element, quite frankly, of why we're not to the end of this process as yet is because of an arcane constitution that actually, doesn't just focus on the end result and focus on the help that's needed, and instead seems to put people into different camps, different degrees of responsibility. And I think that's what they're working to sort out. And I really do believe they're trying. We've seen many of these kinds of disputes or disagreements or standoffs over the years based on a constitution that is way out of date in terms of how it treats cities. But I think they're trying very hard, both governments, to work that out. And I'm very optimistic they're going to work it out. It's just that time is of the essence. And so hopefully the constitutional dancing, the constitutional fencing will come to an end very soon. And they will come forward with a significant package that will help us to produce a more robust recovery for the whole country, not just in the cities.
Just follow up on that timing issue. How urgent is it? I mean, my understanding is that all these impacts you laid out, I may be wrong about this, but that you could keep going this year, and then the sort of fiscal cliff would hit the city next year? Is that you have to make up the deficit you're not allowed to run in the following year? Is that right?
Well, yes and no. We are not allowed to budget for a deficit in 2021. But we've already set our budget for 2020, and so if we end up, as we project, at least $1.5 billion short, just based on the money we're losing today from not having transit revenue and not having land transfer tax and other revenues, then we're in a real, real quicksand at the end of the year, because we are not allowed to go out and borrow to finance that deficit as other governments are, and I agree with that provision in the laws. So we would be left at that time with no alternative but to dramatically scale back services or dramatically increase taxes for 2021, and it still doesn't answer the question of what we do about the hangover deficit from 2020. So this is a very real in-year problem, not just for Toronto, but for other cities. And the notion that we should have to be spending our time trying to scrape around, figuring out how we're going to keep going when we're the level of government that is actually providing services directly to people, homeless people, elderly people, people who are hungry, is transit services. This is not good. But that's why I'm saying that we need urgent help, and we need these governments to finish the constitutional fencing and to fashion a solution, which I think they're trying hard to do, but these things don't always happen on the timetable you would like. I'm told they're making progress, and that we hopefully will have some results sooner than later.
Okay, next we go to Jennifer Pagliaro from the Toronto Star. Jen, go ahead.
Hey there. I'm just trying to understand exactly how immediate the risk is. Mayor Tory, you outlined a sort of doomsday scenario not that long ago, and we heard earlier from the city manager that we had a way to get through this financially until essentially today. So I'm just wondering what the further strategy is, given that there's been no additional promises made by either government.
Well, I think I've laid out, together with the city manager and the chief financial officer, that there are really only, three alternatives or permutations and combinations of three alternatives. One is to receive support in the quantum that we and other cities have set out across the country, because this applies to Toronto but also to other cities, and that would help us to obviously be able to continue to provide services without additional raises in taxes. The second is to raise taxes. We've estimated in order to make up for the $1.5 billion shortfall for this year alone, that would involve, huge tax increases of the order of which people have never seen before and that they can't bear right now. And the third is the massive kinds of service cuts that I set out in a list that was not exaggerated. It was a straightforward mathematical calculation of how many services of different kinds we would have to eliminate if we don't get help. And so that is why I can't even find it fathomable or imaginable that those governments will not step forward. I think they are involved in an element of constitutional fencing at the moment. There's a certain amount of that, I guess, we've always had in this country, but now the time has come, I think, for that to come to an end and for these governments to come forward with the help they know they have to give to see the economic engines of this country, starting with its most important economic engine, Toronto, to be healthy and to lead the recovery. And so, we're obviously doing our planning as to find other ways in which we can achieve efficiencies inside the city government and things like that, but we're very much engaged in the present round of discussions with the other governments on the basis that is our number one and most important, most obvious, most sensible, most fair strategy, which is to get those governments who have access to income taxes, corporate taxes, sales taxes, to make the best investment they could ever make in terms of getting a return and in terms of getting a good recovery, which is in the cities of this country.
I just wanted to ask, I know that of the list that you read out of possible cuts, the police service was on there, but just given what's been happening on the continent in the last little while, there's been additional comments made that we are funding our police service more than $1 billion. There's been ongoing concern about that, obviously prior to this past weekend, but I just wonder if there's any real consideration being given to the ongoing funding of that single budget item.
The consideration that's being given for the ongoing funding of the police is that we have to continue to fund them. People want, as much as anything else they want, a safe city. And we invested additional resources this year, for example, in community policing, which is going to exactly the issues that are being talked about as part of the agenda in the crowd that marched in such a heartfelt way this past weekend. We've got to restore trust in the police. We're going to restore trust by having police officers in the community for years at a time, the same police officers, actually walking through the neighborhoods, developing relationships with people, if we're going to fight guns and gangs. All of this costs money. This notion we're going to defund the police, and I don't know whether we're not going to have police or whatever, is not a credible option. I don't think anybody can realistically put it forward. We are watching every penny of every dollar we spend on the police and everything else, but if you want to have things like community policing, if you want to have things that fight guns and gangs effectively, and all that involves, including technology and highly trained officers, then it costs money. And we're going to be watching every dollar, but we need to make sure the city remains safe, because that's fundamental to a good quality of life and to a strong economy, among other things.
Okay, thank you. Final question is to Michelle McQuigg from the Canadian Press. Go ahead, Michelle.
Thank you. Mayor Tory, just a quick question, circling back a little bit to something we were discussing last week. At that point, when discussing the Regis Kaczynski-Paquet case, Chief Saunders indicated that this was a sort of a perfect scenario for body cameras. In light of the concerns raised by racialized communities within Toronto, I was wondering if there were measures like that that you would like to see put in place or investigated further.
I'm a strong supporter of body-worn cameras, and it is something that is provided for in the police budget for this year. The request for proposals from people who would supply those cameras and all the related equipment is out there right now and is to be concluded fairly shortly, and I'm very hopeful that we can follow along with what the chief wants to do, which is to expedite that process as much as we possibly can to get those cameras on people's uniforms, because I think they're the best way in which we can ensure that the public has that kind of a record of things that go on, and that is going to be for the protection of both the citizens, but also for the police officers. And so I'm working with the chief and was talking to him about it as recently as today as to ways in which we can expedite the final approval of that and the actual implementation of that sometime as soon as possible.
Thank you. And are there any other additional measures that you'd like to see put in place in Toronto, either to address the needs of racialized communities or people who might be in crisis in terms of how to interact with police?
I think there's two things we have to continue to work at, and we've made great strides in the last number of years, but we have much more to do. The first is on continued sensitivity training on the part of our police service to make sure that they are as equipped as they possibly can be to deal with what are very complex challenges of policing in the most diverse city in the world. But they are special challenges, and they're ones we simply have to take on in light of the fact that there is still racism that occurs in this city in a number of different quarters that our police officers have to be sensitive to. And the second is mental health. I think that while, again, we've given hugely increased training and resources to our men and women of our police service in dealing with people in crisis, there's more to be done there, not necessarily all applied to the police officers themselves, who have a very difficult job to do and encounter, I think, 30,000 people in crisis every year in their rounds, but also in making sure we have more of these mobile crisis intervention teams and other resources like that of people who are specifically and exclusively trained in dealing with people in crisis, and I think that is going to be something we're going to continue to have a hard look at as we go forward, because there are increasing numbers of people. I think our treatment of mental health generally in this country and in this province has been way short of the standard that we should expect in terms of the allocation of resources within the healthcare system. And I think if that were to be stepped up based on commitments already made by the other governments, that would help the police too, because many more of these people would be dealt with in settings other than in encounters with the police to begin with. But having said that, the police have their job to do, and I think that the more we can train them, the more we can support them in having other highly trained resources that are doing that job with them, the better off we're going to be in terms of handling some of these issues that are very much at the forefront now.
All right, thank you for joining, everybody. That concludes today's briefing. The next briefing will be here on Wednesday, June 3rd at 3:45 p.m. Stay well.